Representative Payton, you're recognized, and then we're going to go to our last question.
Thank you, Madam Chair. My question for the panel, I'm not an economist, but if you could help me understand, on one hand, a program pays for the medical needs of a population. On the other hand, the same population, the same medical needs, pays a third party to cover those needs with a guaranteed margin, profit margin. How can that be budget neutral?
Well, there are a number of factors that come into effect. One is, there are people who will complain about the Medicaid program that we don't do enough about waste, fraud, and abuse, and maybe there's less of it in the private sector, that the private sector is better at utilization management. They have some tools that we don't have. But you know, if we want to control the Medicaid program, we have to come to this body and get it approved. If a private insurance company wants to control costs, they can just make changes in some cases. So, the markets are just a little bit different. But, your argument is good, which is there is some profit built in for those companies. And really the efficiency has to overcome that. One of the arguments with the private option was that you're not only comparing the Medicaid population and expansion population either in one market or the other, but that when we put them in the private market, it helps keep costs down for everybody. And so the broader impact, which is not part of these calculations, the GAO report, but will be after 2017, when you can start looking at that the total impact on the federal government could be significantly better because the subsidies they pay for the higher part of the market, the subsidies the federal government in effect pays, when you're able to write off your health insurance costs, you're writing off a bigger cost if your premiums are higher. So it actually costs the federal government more. When all that comes into play, it actually may be cheaper to serve people through the private sector.
Well, two things that concern me. It's easy to bring the price per head down when you bring people in who do not have the needs into the mix. And your numbers of people who receive the benefits go up, your overall cost goes up, but your price per head comes down because you have people in there that do not have needs. The big question on my mind as we go into this study and observation about the effectiveness of the private option is what would the rates be if the insurance companies were not worried about the political survival of the private option. Right now I think they're highly motivated to keep rates low because they know that the political survival of the program is at stake. And, I'm concerned about what those rates would be if they were not worried about the political survival of the private option. And those are things that are speculative. We'll never know the answer to, I guess, but appreciate your input for that.
Just my only addition would be, I think, if you believe competitiveness drives price down, that the lack of competitiveness allows prices to float. That's what the private option is testing in the private.
Well, and I do believe that when it's a supplier-consumer relationship, when you have a third party that is paying, I think, it can become clouded easily.